Welcome to Blowing Solutions Wide Open, where we're talking about all things spiritual as well as creating new systems in the area of healthcare, government, finance, education, and new environmental practices. My name is Addie Halkin. Thank you so much for joining me. If you think that you have ideas in any of the areas that I just mentioned, please feel free to email me at blowingsolutionswideopen@gmail.com, or you can type guests in the comment section. I'd be happy to chat with you and see if it's a good fit for you to come on here and share what you know. Please feel free to like, subscribe, comment, share all those good things. The more we get these alternative ideas out to the masses, I think the better. Excuse me. Well, today I am very excited. I have what appears to me to be a very high quality guest, and I want to start by welcoming Karese Laguerre. I did say that right, correct?
Yeah,
All right. So Karese is a registered dental hygienist and myofascia therapist. She founded the MyoSpot, a practice aimed at amplifying oral wellness to whole body wellness. Through teletherapy, she helps clients of all ages overcome tongue ties, TMG orders, sleep apnea, grinding, anxiety, and various breathing and oral fascial dysfunction. Passionate about education and self-help, she published the book Accomplished, which is about how to sleep better, eliminate burnout, and execute goals. When not working with clients globally, Curry spends time with her husband and four kids. Welcome. I think for me, I am just really curious as to probably the most maybe important thing that you feel like you do with your career.
absolutely. Well, thank you for having me, first of all. The most important thing I think I do is I bring awareness to one of the most important parts of the body. We can go for days without food, days without water, I'm sorry, weeks without food, but we can't go any more than a few minutes without air. And so, all my work is really focused around the upper respiratory tract. And while everybody might be very forward focused on muscles that are in their body, shoulders down. You go to the gym, you work out. We compliment people who have really good musculature and, form and physique. But I think the most important thing I do is bring attention to all the muscles that are supporting our upper respiratory tract that are really at the root of a lot of systemic health problems. And so being able to bring awareness there, I think that's the biggest thing I do as a myofunctional therapist.
Yeah, I I could not agree more. I think that it's really easy to miss how important that area of the body is. I can speak from my own experiences. Uh, you're right. You cannot go very long without air. So, all right. So let me ask you, one of the things that I saw you speak a lot about is tongue-tied, and I don't know what that is. So if you want to explain that to people and me, I'd love to hear about it.
Absolutely. Absolutely. So tongue ties are a bit of a controversy, right? So there's mention of tongue tie in the Bible, like it's been a talk for centuries and centuries. Midwives used to keep a very long fingernail and then they would just kind of slice the tongue ties off of the babies once they were born. This is well before we started, penicillin and those types of things. So tongue ties have been around for a long time. Essentially, all that is that there is a string underneath our tongue. Everybody has one. It's totally normal. Even if you have a tongue tie release, the body redevelops one. So there's a string of tissue. It's all fascial tissue. It's just connecting the base of the tongue with the floor of the mouth. Some people, it's a tongue tie if it's restricted. So that frenum, the frenum is the name of the tissue, that tongue frenum could be short in some people or attached too forward in some people, and it will restrict their ability to have a good range of motion for their tongue. Our tongue is a very vital organ. I know a lot of people like to commonly misthink of it as a muscle, as like the strongest muscle in the body. I hear that all the time, and that is so inaccurate. Our tongue is incredibly important. It's made up of 8 different muscles that innervate it. They're in pairs, so it's really 16 different muscles innervating it. And that tongue has to get up on the roof of the mouth at rest in order to help us to self-regulate our autonomic nervous system, to respirate and stimulate the nasal floor, to help us to really breathe, chew, swallow, and speak properly. And so if you have a tongue tie, for a lot of people, that will, prohibit them from having the ability to keep their tongue at rest up against their roof of the mouth, their palate, or be able to functionally utilize it when they're breathing, chewing, swallowing, and so forth.
Okay. All right. Very interesting. So, what would you say is like in your practice, what would you say is the number one thing that you see that causes people breathing problems? Is that it, or is
It's, well, you know what? I think if I have to say tongue tie, I would put two as number two. So the number one thing is really just insufficient use of the tongue. Sometimes we get in these really bad patterns where oral function and how our tongue functions, a lot of that is established very early on in life. So, how you were fed when you were younger, if you were breastfed versus bottle fed, those are two completely different mechanisms of action, especially for the tongue, the lips, the cheeks, to have to coordinate or not have to coordinate. I think all of us are very familiar with the fact that some of these bottles used to be able to turn it over and then the milk would drip down on your hands. And that's how you would know whether or not it was too hot or, if it was still cold and you needed to warm it more. Well, that's not the way it works with the breast tissue and, being able to breastfeed. It takes a lot of work to get the liquid out of the breast tissue. And so how we coordinate is really going to determine how we're using our tongue. Now, all of that, development very early on, either it's going to be matured in its function, or sometimes the bottles are gone for too long, going on for too long, and the sippy cups are held for too long. We go into pouches, and so they're not adequately chewing, like they're not using open cups. And so some of that is just dysfunction that's just lingering throughout your life. And I would say that that's probably the number one thing that's really going to prohibit people from using their tongue the way that they should, is that it didn't start early off in life. And, sometimes you get to age 10, 20, 30, 40, and you're still misusing those muscles.
okay? So you would say that's the misuse of the muscles is the number one breathing such.
Absolutely. Absolutely.
Okay, interesting. All right. So, um, let me say, let's say if you have like somebody who comes in and it's not necessarily a tongue issue, it's an allergy issue, for example.
Yeah.
Do you have that? Do you have a lot of that that comes through your office?
Oh, yeah.
Offices?
Absolutely. So with myofunctional therapy, we deal with a lot of people who breathe through their mouth. So oral respiration is meant to be like emergency use only. Okay. That's like driving on your spare tires and like expecting your car to, drive appropriately. So our mouth breathing is going to make you more prone to, because you're not going to be able to adequately filter out certain types of allergens and so forth. So it's going to make you more prone to having these reactions and allergens. So I see a lot of people who struggle with allergies. I actually share a lot of patient community or pool with ENTs, ear, nose, throat doctors, or allergists as well. It is incredibly important that we kind of rule out what's what, sometimes making dietary modifications, sometimes switching from oral respiration to nasal respiration is actually the key. And those things just can change how you are reacting or how inflamed your body becomes when you're around any sort of allergen.
Okay, very interesting. All right. So then how does the dental aspect of what you do play into, because we're talking about the breathing stuff, but how much of it, I know I'm obviously they're close to each other, but
Yeah.
um I guess
That's
I
a
guess go ahead.
It's a really great question. And I think we get that a lot, especially being a dental professional with my primary profession. I think that with dentistry, if we would just really take a step back and think about anatomy, and I know that's so far back, even some of the dental people I talk to, it's like, oh, anatomy, I don't remember all this stuff, but just the simplest things, right? So, our upper arch of teeth and the roof of our mouth, so that maxillary arch, that is actually a shared bone and space with the nasal floor. So when we're talking about breathing and adequate breathing, or the tongue being up for breathing and how that stimulates certain things and how that impacts digestion and speech and, cognitive sort of regulation, it is something where if we consider that if you're looking at your upper arch of teeth and it's very narrow, or if the roof of your mouth is very high and very shallow in width, that's going to be a reflection of your nasal floor. Like if you've got a narrow space in the mouth, that's immediately your like telltale sign that you've got a nasal floor that is very narrow as well. If you open up your mouth, just like everybody does when they go to the dentist, the first thing that dentist should be able to see is your uvula. For those who don't know, that's that dangly ball at the back of your soft palate. You should be able to see your uvula. You should be able to see the back of your throat. You should be able to see all the way back there. Some people, they open up and all they see is their tongue and, just a bit of the front of the palate, the roof of the mouth. They don't see all of it, right? So that's an indication that there's something going on there. Like, how come your oral airway, the oral pharyngeal space, we can't see right away, right? So with dentistry, we're actively looking at these things, whereas your doctor, physician might be going and saying, hey, say and they use a tongue depressor or tongue blade, they might call it, to depress down the back of the tongue without ever questioning why we can't see it right off the bat. When you open your mouth, we should just be able to see in the back of the throat. You should be able to see your tonsils. That's an indication that, you don't have a whole lot of upper respiratory airway space. It's all really closed off right off the bat. And so that's another great reason why dentistry is a part of this role, because we're looking at things from how they function. The lower jaw as well is the final piece of the puzzle. That lower jaw is the front and lateral, so sides, front and lateral borders of the upper respiratory tract. When you have a mandible or a lower arch that's pushed back and a little bit more recessed, when it's pushed back and far away from your upper arch, that's impinging on some of your upper respiratory space in the throat. Like you won't be able to have as much of a airway space. And so it's incredibly important and very much connected. But I think because our models of healthcare or traditional healthcare, at least per insurance, are so separated, we kind of disassociate the fact that all of this is attached to the rest of our body, and that we have these connections that are so very strong. So yeah, dentistry is incredibly important.
Okay, so then that, I guess, moves me into, one of the reasons, just so everyone knows, why I felt like Karese really ties into this channel is because she has, expressed that you yourself only do holistic. Is that correct?
Yes,
And so,
yes.
okay, great. So, that's part of what I want to ask about is then what are some of the things that you do with a patient when they've got these, structural issues, because what are they supposed to do about their structure?
Absolutely. So there's a certain extent of it to which myofunctional therapy can help to influence and or change in a more positive trajectory, right? So when they have certain issues, it's incredibly important that we work on the soft tissues, because the soft tissues, the lips, the cheeks, the tongue, and the pressures that they apply on our cranial bones, that actually influences the position, the development when we're younger of these bones. And so if you have a change in those pressures or those patterns and it's more positive, there are some people who get positive changes. Things change in their face and their facial shape. People that have forward head posture, it winds up straightening itself out. We're able to really get to positive change in the body. It's not going to be as dramatic as like what would happen if you went and you got, plastic surgery, or you did, oral
Right.
surgery, you did all that stuff, but you will see positive changes. So what is it that I do? We do exercises. We work on the musculature. So when there's dysfunction with the muscles, it's always going to be a chain of problems. So if you have one muscle that is underdeveloped or overdeveloped, it's going to have an impact where it's probably not doing its job or carrying its weight when you're doing certain tasks like swallowing, like speaking and drinking, whatever you're doing, it's going to probably recruit or pull in some other muscles. So now we've got compensatory patterns, and all of these things need to be unwound, especially for adults, because you've been doing these things like I mentioned a little earlier, since you were young. And so it's harder to create new muscle patterns. I mean, anybody who's ever tried to get six pack abs, I think you know, like it's very difficult to create muscular patterns in adulthood. But what I do is really help to change those muscular patterns. And in that way, we see a lot of facial changes and good positive change towards better trajectory for a possibility for them to not need other interventions.
That sounds so much better to me than medicine.
Oh,
Um,
yeah.
I mean, that sounds like long term, where it actually lasts and it doesn't hurt your body, it helps your body. So that's exactly the kind of thing that I like to hear. And I feel like, not enough of us know about stuff like this. And so that's really a lot of why I wanted to hear what you have to say. What are some of the other, do you use natural holistic herbs, or what are some of the other you know things that you do, and you don't have to give away specifics or anything like that, but some of the other things that you do around these issues that you come across with your clients?
I am a Reiki master. I very much
Oh,
believe in energy and energy work and how that all plays a role into how we're able to heal. I love the concept of Reiki and energy work because a lot of it is so autonomous. Like you're responsible for the energy, and the energy transfer isn't necessarily, you're a conduit as a Reiki master for the energy, but their reception of it and how their body receives the energy, there's so much autonomy there, and I think that that's incredibly important. I love to incorporate energy work in what I do with the muscles and the function and so forth. I'm also a big believer in cranial nerve integration, and so we do various exercises and things to get those cranial nerves aligned and firing appropriately, because a lot of times these 12 cranial nerves that we have are really the root of a lot of things like our organ function and regulation and so forth. And if there's anything off, that's going to impact the ability for, results to stay and to be lasting for as long as we want them to last, a lifetime. So I'm a big believer in incorporating a lot of different things, but the Reiki and the cranial nerves, I would say, are like the two that I'm doing. I would say it's 33, 33, 33 Reiki, myofunctional therapy, and doing the cranial nerves.
that's very interesting to me. I actually, I'm going to talk to you after this video. The cranial nerve thing really interests me. There, yeah, wow. Okay, so, not to make this one all about me, but let's talk. Um, can you tell me? I noticed that well, first of all, I know that you have a book and a PDF out, called Accomplished. And I haven't gotten through the whole PDF, but you're extremely good at your writing. And can you share with me a little bit about what you're sharing in
Yeah.
that book?
Yes. Well, thank you for the compliment. Accomplished is a labor of love. I don't think there's enough conversations that any of us are having around sleep and how well linked, holistic solutions are, like just readjusting the way that you're breathing or the way that you are approaching sleep. There's a lot of information out there about, there's this pillow, there's this device, there's this thing that you can do. And a lot of it, you can do all of those things. And sometimes, if you're just not breathing appropriately, your body is going to shift from trying to achieve restorative functions that we would optimally need to recover at the end of a day, to just keeping you alive, because you're not breathing, and we can't have the body, not having enough oxygen, the brain needs to function and so forth. So I wanted to have a book out there that would really focus on the important aspects of sleep. And that's a big chunk of what I talk about there, is like how you're respirating. It's really going to impact your sleep. And then from there, what can you do about it? So in the book is my CARE process. It's an acronym. So CARE, it stands for 4 different things. And these are the things that you can do to really help you to get to optimal sleep. That way you can eliminate burnout and execute goals.
Yeah, I mean, you look like the picture of health. So whatever you're doing is working. Another thing I'm super interested in. Very cool. All right. So you spoke about your son. And oh, and by the way, before I forget, I want to mention that that book is on Amazon. I'm going to
Yeah.
link it in the description of this video. The PDF, is that the best thing to link in there?
Yeah.
Or
Well, yeah, I think I sent you a link for the
for
Amazon.
Amazon as well. Yeah, I'll link them both if you'd like. In the description, I can also link that in our comment section as well, if you guys are interested, because clearly this gal has a ton of information on this subject, and I really want people to have that information. But one of the things I want to ask about is that you mentioned your son with ADHD and how you were able to uh, go out about that in a holistic way, and
Yeah.
you didn't buy into the medical diagnoses and what they wanted to do. So if you want to tell us a little bit about that story.
Absolutely. My son, I had him when I was very young, and we kind of, in a way, grew up together in a sort of way, very loosely.
Mhm.
But I remember distinctly kindergarten. We would be in the classroom for the parent-teacher meetings or discussions, whatever it is when they're in kindergarten, because it's not like a real serious parent-teacher meeting. But they're telling me that he would find, so when there's a ray of light, you know that you can see the little dust particles kind of flying around the room. And he would find one of those little dust particles and would just really have his eyes just following that gaze. They could not get him to pay attention for circle time or, anything that required his attention outside of like free play. And I just thought to myself, well, he's 5 years old, lady. Like, he doesn't want to pay attention. That's fine. It doesn't seem like he has a focus problem because he's focused on the dust. Like, that's that's where he's focused. So very clearly he's fine. Um, then first grade happened and it was a similar conversation. I'm like, but he's 6. Like, he's relax, he's 6. Second grade, third grade. And I mean, it happened every single year. And at some point, really, fifth grade was the big telltale thing for me because he was not doing well anymore at all. It was very difficult for him. And, he was struggling with just keeping up. And it was looking like he probably might have to repeat fifth grade if we didn't if we didn't make a change. So we we waited 6 months for an appointment with a pediatric neurologist. And it was the person to see in our state at the time. So we wait, we get that appointment, we see the doctor, and I swear it couldn't have been any more than 15 minutes that we spent with her. She had a piece of paper. She's running down the list, asking us questions. It's like a questionnaire. It's like we're taking a test. Does he do this? Does he do that? That. Boom, ADHD. Like, that's the diagnosis right off the bat. Didn't really, spend much time with him or assessing him or evaluating him at all. So it gives us a script, and the medication didn't do very much of anything. And it was very frustrating for me because we went through this cycle for a couple of years on and off. Now, no, a year and a half, just about, went through this cycle. And at some point, I kind of was introduced into this world of myofunctional therapy and the way that he was breathing and how all of that is so very connected, and that his sleep might be a big causative factor. Like, he's not breathing appropriately, therefore his sleep is impacted. And we were so close to a neurologist appointment, one of our follow-up appointments at that time where these worlds kind of collided. And I remember sitting with her and saying, I don't want medication. I really don't want another medication. These medications have not been working. And I really don't like the idea of drugging my child just so that he could, go to school. I don't want to do that. But what I do want to do is I want to check out his sleep because I think I'm going to take this in another route. I think I'm going to deal with it more holistically. And immediately she said, whoa, whoa, whoa. You never told me that he had an issue with sleep. If you told me he had an issue with sleep, I would have told you that there was this correlation and so forth. But by the time she's saying all of this, one, she never asked me about his sleep, not once, not once. But by the time she's saying all of this, I already know that there's a 70% overlap. Like I had gotten that information and was very well versed in it, that there was a 70% overlap in the manifestations, so the symptoms of ADHD and that and sleep deprivation in children. So with a 70% overlap, when you have something like ADHD, I mentioned what she did with the questionnaire, and it's not to judge that process because that's the only way to diagnose ADHD. We can't get a blood test that says, oh, yep, you got that gene. You cannot find it on MRI. You can't do a CAT scan of the brain and be like, yep, there's the ADHD. It's just a symptom based thing. If there's a 70% overlap with sleep issues, shouldn't that be the differential diagnosis that we're all going for first? Because it is so much easier to find natural ways to help these children sleep better, which is going to impact a lot of other things, their immunity, their ability to really concentrate and focus in school. It's going to be incredibly impactful if we're working on their sleep, as opposed to filling them with these pharmaceuticals that do what really? And then what's the side effects of that? The side effects of better sleep, these are the positive things. So working with my son, we were immediately after that appointment, I never wanted to see that neurologist ever again. And we didn't need to. We really just worked on his sleep. He had sleep disordered breathing and difficulty with sleep. And so we really worked on his breathing and his daytime, nighttime posture. And it was night and day. And from this little boy who in fifth grade was struggling to really keep up, and it wasn't looking good, he went to become this 17-year-old boy who was able to graduate high school a year ahead of his peers. He was absolutely just brilliant, this really smart, intelligent child that was just burdened by the inability to sleep. And so that's really fueled a passion in me where, we need to have more of these conversations because not enough of us are talking about it. Clearly, the physicians aren't talking about it. It is something that needs to be addressed. The ADHD could be a false diagnosis for some children because there's that 70% overlap. And I think we all need to address it when we can in the most holistic ways possible.
Wow. That's making me wonder if a lot of these diagnoses, I mean, to me, they're just human labels, but are actually associated with lack of sleep. I feel like, for me personally, that's that's a lot of my mental problems is lack of sleep. So I'm wondering if you're really kind of onto something and it's just not being recognized enough, not just with ADHD.
Yeah, no, I wouldn't be surprised. I mean, when you're getting better sleep, sleep has so many wonderful functional purposes from our memory and being able to really drain the brain from you detoxing your brain at night, being able to restore cell function, your immune cells are able to reproduce. Like you're getting a lot done when you're sleeping. You're completely unconscious of it, but your body is working overtime to help you recover. And when all of that is put on pause, it's going to have impacts. Like if you find your immunity is not what it used to be, it might be because you're not getting good sleep. If you find you can't concentrate the way you used to, could be because of the lack of sleep. It's a number of things that could be impacted as a result. I'll tell you that one of the statistics that's probably the most alarming is that when it comes to obstructive sleep apnea, and you have people who, pass away in their sleep or have these major heart attacks or strokes, it's typically between 4 to 6 a.m. And that's because the whole night, the body has been kind of struggling with breathing and all the start and stop of breathing, that the cardiac overload is what really is the stimulus for these major cardiac events. And so there's a number of ways that sleep can really be detrimental to overall systemic health if we're not getting good quality sleep.
Interesting. Yeah, I can't say I disagree with that from my own experiences. Yeah, I'll get into that with you later, but um okay, so what else would you say I mean I don't know how much of your clientele you're dealing with sleep issues, but you said that the number one thing that you're seeing is just poor function of the tongue. that's
Yes.
causing breathing problems. But um, what else would you say as far as I know you said tongue tie is the next situation that you're seeing. What else are you
Yeah.
seeing in your clients? What else would somebody come to you for?
Yeah, so our corticomotor function, our muscle function, our muscle function is absolutely something just overall, especially with breathing and sleep. So let's imagine that let's I'm gonna rephrase this whole thing. The first stages of sleep involve muscle relaxation. So if you're going to lie down and you're going to go to sleep, we have a force of gravity that's exerted on us. And then on top of that, our muscles are now going to relax. And that makes our upper respiratory tract, your whole throat is full of soft tissue. It's going to make it more susceptible to closing, which is, a lot of what happens in obstructive sleep apnea and so forth, right? When you wake up and you have that gas, right? So let's imagine that we have somebody that has six-pack abs and we lie them down to put them to sleep. The first phase of anything is the gravity that is pushed and exerted on them. Those six-pack abs, when they lie down to go to sleep, gravity makes no change, no shift in them. Their six-pack abs are pretty tight and in place. Nothing's moving. Now, muscle relaxation. So when they go to sleep, muscles relax, but their muscles are pretty well engaged. Even at rest, those six-pack abs are just firm. So now they're at rest in sleep, and it's still very prominent. They're able to sustain the shape, right? Let's take somebody who has a beer belly. We're going to lie them down to go to sleep. They're going to lie down to go to sleep. First stage, gravity. Immediately, the beer belly doesn't look as prominent and round as it did before. Things have shifted. Now, muscle relaxation, things start to shift a little bit more. Let's imagine those muscles as our upper respiratory tract. So we lie down to go to sleep, and first thing is gravity. So if you're on your back, it's going to push everything back and down. The tongue could fall back into the airway a little bit, or it might just fall back towards that space and not completely occlude it. But then muscle relaxation and all the muscles that are there start to close in on themselves, giving you a very narrow passage to begin with. So you have some people who they fall asleep and they probably don't realize they fell asleep. If you're watching a movie or something and they've fallen asleep just lightly and immediately it goes to a snore, that's what's happening. So that snore is the sound of air meeting resistance as it's going through the upper respiratory tract. So as they're trying to breathe, you can hear the closure of this space that the muscles have started to close off. When they were awake, you didn't hear them breathing at all. And then gravity and muscle relaxation happen, and suddenly now they can't maintain their open airway. What happens with myofunctional therapy is that we're able to work on a lot of these muscles, the velopharyngeal muscles, like the oral pharynx muscles. So all of the soft tissue that's in the upper respiratory tract, we're able to work on. And when you have those muscles, like six-pack abs, strengthened and very well able to sustain themselves, well, now muscle relaxation doesn't impact it in the same way. And so when it comes to sleep, it's incredibly important that we start working on our muscles that are above our shoulders. I know everybody wants to go to the gym, you want to lift weights, you want to work out, but like these muscles above the shoulders, these are the ones that truly matter. Not to say that the others don't matter. I like looking at a good pair of six-pack abs too, but these, I'd much rather have a six-pack airway when it comes to sleep.
Yeah, that makes a lot of sense to me, actually. Um, you know, yeah, and I don't actually hear anybody talking about that. So I think that's a big value to what you're doing. Um, so we are running short on time for this video. I'm happy to have you on a part two if you want, but I do want to get out. I want you to talk to us about, where you work, how people get a hold of you, make sure that everybody has that information. Plus, I'm happy to put it in the description and comments and things like that. But
Absolutely. So I first of all, thank you for having me. I've loved this.
glad
I
to.
am I'm on Facebook, I'm on Instagram, I'm on TikTok, all at the Myospot, TheMyospot. at the MyoSpot. You can find me at my website. I'm themyospot.com, where you can learn more about myofunctional therapy. And you can also schedule a free consultation with me if any of this resonated with you and you really would like to learn more about how myofunctional therapy can benefit you. I do free consultations. I mean, you can schedule one right on my website. And I am just really happy to talk to anybody about it because it's made such a difference in my life and many of the people that I've worked with. It made such a difference. And so I'm very, very passionate about this topic. And I'm so happy that I was able to share here today. I appreciate you, Addie.
And oh no, I appreciate you. This is right down my alley. So, and let me make it clear, you do work remote, correct?
Yes. Yeah.
Um, and I know I personally worked with he was just a half, regular doctor and half alternative doctor over the phone at one point. And actually, you would not think that it's doable, but it really is. It was really a value to me. So, for those of you who are not, do you want to mention the states that you actually have physical locations in, or
Yes. So I work in person in New Jersey and in the West Palm Beach area of Florida. Florida is a bit bigger of a state. So I see people in both of those states, but I do virtual and telehealth with people all over the globe.
yeah, okay. Yeah, and I think that, it doesn't require an actual physical visit because you have all the information. So, just for everybody to know that. And so, yeah, I think that we can end this particular one here, but if you have more to share, I'd love to have you on for a part two. If you think that you've wrapped it all up, that's great too. Whatever you want to do is good for me.
Yeah, no, I think this has been great.
Okay.
I don't know. If you have more questions, I'm happy to keep going.
I think I got a pretty good idea. The only thing is that one quick question, I have to make it fast, but do you have more dentistry clients or do you have more breathing, or are they about equal?
I'd say they're about equal just
Okay.
because I get a lot of referrals from dentists and so forth. So I see a lot of people who have dental issues, but it's roughly equul.
Okay, perfect. All right.
Yeah.
Well, great.
Awesome.
Thank you. I'm so happy to have you. You're a lovely person, full of value for people. And so I'm going to leave your information, and you are always welcome back here. And thank you so much for coming on.
Oh, no problem. Thank you for having me.
Yo,
Have a
you're
great
welcome. Thank you. Thank you guys. Talk to you later. Take care.